Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take a few moments to talk with you about genital warts or condyloma. In this video, I will define the problem, tell how the diagnosis is made, and what treatment is available for this common sexually transmitted disease. Genital warts are often called human papillomavirus and is usually a result of sexual intimacy with someone who also has these genital warts. They usually appear as flesh-colored or gray-like growths found on the genital area and anal region in both men and women. The lesions are referred to as venereal warts or Condyloma acuminata, and it's caused by the HPV virus, standing for human papilloma virus. The lesions usually occur in men and women between the ages of 17 and 33, and the virus is highly contagious. 60% of people will get an infection from a single sexual contact within 3 months after sexual intimacy. 20% of people with genital warts will have other sexually transmitted diseases. The common warts that are found on the hands and fingers are not the same as genital warts, and that is caused by a different type of HPV virus that infects the skin. The symptoms of venereal warts are usually painless lesions, and they usually become bothersome because of their size, location, or due to the fact that they cause itching. Rarely do they cause bleeding or urinary obstruction, but this may occur especially in men if the lesion involves the urethral opening, and that is the tube in the penis connecting the bladder to the outside. Warts are also common in additional areas in addition to being on the penis or in the vagina. In men, the lesions occur in the urethra, the penis, the scrotum, and the rectal area. In women, they usually occur in the moist area of the opening of the vagina or along the labia. The diagnosis is easily made by enhancing the lesions using a technique called acetowhitening. This consists of the application of a 5% acetic acid solution that is left on the genital area for approximately 5 to 10 minutes, and the infected areas will turn white. The medical treatment for venereal warts or condyloma can be accomplished in the doctor's office using podophyllin resin. Also, there is a drug, a solution called Condylox, that can be topically applied at home and has a very high cure rate for very small lesions. Other drugs used to treat condyloma include 5-fluorouracil and Aldera. For larger warts, interferon alpha can be injected into the lesions for those lesions that do not respond to other therapies. Interestingly enough, about 10 to 20% of condyloma will go away without any treatment in 3 to 4 months. Those that do not go away and do not respond to topical treatment can be treated with liquid nitrogen. It is a technique that kills the wart by kills the virus by freezing the wart. For larger lesions, cautery current can be used in the doctor's office under a local anesthesia to remove the wart as well as the virus. For those larger lesions that do not respond to topical therapy or medication, laser treatment can be used for recurrent genital warts or for larger lesions that do not respond to medication or to cautery. This usually requires a local or general anesthesia. It is usually quite expensive, however, it is paid for by insurance companies. And if surgery is used, there is usually increased healing time and a slight increased risk of scarring. The follow-up for men and women with condyloma is very important. Women will need a routine pap smear and investigation for HPV of the vaginal canal and the cervix, particularly if they are of childbearing age. You need to see that the lesions are completely eradicated and gone before resuming sexual intimacy without protection. Also, it is important that men and women with HPV be checked for other sexually transmitted diseases as well. Condyloma can be prevented with the use of a condom. Infected individuals need to refrain from sexual activity until therapy is complete, or to continue to use a condom until the lesions are completely gone. Persistence of the virus can occur in the surrounding skin and hair follicles or on sites that are missed by the treatment. Deep lesions that cannot be eradicated are also a cause for recurrence. In summary, HPV or venereal warts is a common sexually transmitted disease. The disease can be easily diagnosed and treated most time in the doctor's office. And also that condoms are capable of preventing transmission of the human papilloma virus. I hope you have found this video useful and helpful. If you have additional questions, I'd like to refer you to my website, www.neilbaum.com, or you're welcome to contact my office at 504-891-8454. Thank you.